Hey everyone, my name is Jeffrey Perera, and today I'm here at the IFSO World Congress 2022 with Dr. Nada Mahmoud, a surgical resident at Cairo University Teaching Hospital in Egypt. Who are you, and what do you do?
Hi, first of all, thank you for having me. So I'm a surgical resident, like you said. Prior to that, I was a psychiatry resident for 2.5 years, and then I realized it's not for me, so I quit my job, and here I am training as surgery in Egypt.
So tell me about your childhood and how you found yourself pursuing med school in the first place.
So I had a pretty straightforward childhood. My mom's a physician, but she's a retired physician, so she never actually worked. But I must admit, she had a huge influence on my decision to pursue med school, because she used to always help me, study the human body, and she always taught me to understand as opposed to memorize, which a lot of people unfortunately do when they study biology and the human body. So my interest in understanding more about how the human body works, my curiosity and all of that obviously led me to deciding or wanting to pursue medical school. And I did, and of course there were many moments where I wanted to quit med school because it's very, very difficult. And the way it is where I studied is we don't do pre-med med school, we just go straight into med school into 6-year program. So throughout the 6 years, I thought so many times of quitting, but because I know that's my passion, that's what I want to do, helping people, the philanthropic side of medicine as well, and the good that you do and all of that, and I do believe it's one of the most noble jobs, so I persevered, and here I am.
So you mentioned bariatric surgery and bariatric research.
Yes.
Why is it even important?
Well, bariatric surgery is a relatively new branch or specialty of medicine. It's not one of those historical ones, and the reason it's important to research is because again, the concept of metabolic diseases and obesity and the things that are becoming more and more relevant to us today, because whether it's unhealthy lifestyles or the quality of the food we eat or whatever. So bariatric surgery now has a huge role in patient care and the good that we do in this field and branch of medicine. So the research is important so that we keep moving forward, right? And obviously because we're still discovering so much when it comes to bariatric surgery, a lot of the science out there is just theoretical. A lot is still very, very poorly misunderstood. The types of surgeries we do, the effect they have on the body. Is it a combination of medical and surgical treatment, or with the surgeries, is it malabsorption? Is it restrictive? What's the effect on the physiology of the body? There's so much that we don't know, and with the research, obviously, we can understand better. And even with the stuff that we know, like the kind of surgeries, like not too long ago, the gold standard metabolic or bariatric surgery was a sleeve gastrectomy. Today, it's a Roux-en-Y gastric bypass. Who knows, in a few years down the line, it's going to be something else. And with the emergence of things like robotic surgery as well, that also needs research, because there's a lot of talk on whether robotic surgery is superior to laparoscopic surgery in terms of it's less invasive, or the articulation is better for the surgeon, or the learning curve isn't as high with robotic surgery as it is with laparoscopic surgery, post-operative outcomes, that sort of thing. So there is so much that we still don't know, and obviously the research is the way to find the answers to these questions.
So yeah, you mentioned robotic and laparoscopic surgery. What is the difference between the two?
So laparoscopic is, the traditional inserting the ports and then operating through the ports manually, like the surgeon would be inserting the instruments and operating them themselves with their hands. Robotic is when you obviously insert the ports, but the ports are usually smaller because the instruments you insert are also kind of smaller, and then there's a robot kind of operating. Well, you operate the robot, but the robot is the thing that's actually moving the instruments, so the movements are much more accurate and much more precise. So yeah, like I said, robotic surgery could be the future. Obviously, it's not very accessible to everyone because the robot is also very, very expensive. It's not something that's readily available, but in places like big tertiary centers, big hospitals around the world usually have at least one robot. So yeah, there's a lot of room of improvement, and a lot of people are still debating, is it safer, is it not safer? With robotic surgery also there are papers and there's published literature that there are a higher rate of leaks, higher rate of post-operative complications. So, nothing is set in stone. And back to the original point, research is obviously the way to find out the answers to these issues and the controversial things.
So who's one person that inspired you to pursue the sciences? I know you mentioned your mom earlier in this interview.
My mother, early on, of course, obviously because she studied medicine, and although she hasn't practiced much after she graduated, but with her understanding, she helped me understand better. And like I said, she's the main reason why I never had to memorize anything, not just in biology, not even in med school. And I know that's hard to believe because majority of the people go into med school knowing you have to memorize majority of the stuff. I never, and I'm not exaggerating, I never had to memorize anything. And the stuff that does require recall, I just know by repetition. I don't necessarily sit and memorize anything, but because I have to, read a lot and go over something multiple times, and I just, I recall it because of that. That was early on, and then later on in my career, throughout med school, obviously I've had some great mentors that have really helped me, that have helped me choose what I want to do in my life. And then again, after I graduated, I've been so lucky to meet so many great mentors, surgical mentors, even psychiatry mentors that have really helped me. I'm here today because of them, and the opportunities I've had because of them, the research that I've done because of them, because you can't do anything alone. And especially in this career, mentorship is it carries a huge it carries a lot of weight. I mean, if you don't have great mentors that support you and that help you, you can't grow. Okay, even if you're hardworking, unfortunately that's the case. Even if you're hardworking, even if you tick all the boxes, but without the right mentorship, the right guidance, you won't be able to get anywhere. So if I can recall a few mentors, there's Dr. Matthew Crow, who works at Cleveland Clinic now, the Cleveland Clinic Foundation. There's Dr. Ricard Corsace. They're all bariatric surgeons, world-class surgeons, some of the best in the world. Dr. Gabriel Delgobo, who works at Cleveland Clinic Abu Dhabi, also he's a great mentor, he's a great friend. Just to name a few, I mean, there are so many people, but these are like at the top of my head because I was just with them here at the conference now.
Do you think pineapple belongs on pizza?
That's a good question. I feel like there's no black and white answer when it comes to these things. I know this is a very philosophical answer, but sometimes I'm in the mood for it, but then there are times when I'm like, no, you cannot put pineapples on your pizza.
What qualities do you believe make a great scientist?
Curiosity, the keenness to always know more, learn more, to never be satisfied with the answers that you have, always looking for, reasoning, justification, how to improve, perseverance. This is a very tough field if you do not persevere. Obviously we all have breakdowns, it's difficult on all of us, but you must always pick up yourself and dust yourself off and just keep moving forward. So I feel like to be a great scientist or to be a scientist, you must have these qualities, otherwise it's going to be very difficult to go on.
What was one moment when you realized you knew you made the decision to choose the right career choice?
You mean like the specialty or medicine? Specialty in medicine.
Specialty in medicine.
Okay, so like I told you, I was a psychiatry resident for 2.5 years before I decided to pursue surgery. I've always known I wanted to pursue surgery, but when you're in med school and then you go on, and where I come from, you do a year of internship where you rotate throughout different departments. You don't go straight into residency after med school. And that year really helps you get a good idea and you grasp everything better and you understand what you really want to do. And throughout that year, I was always choosing between psychiatry and surgery. And a lot of people, they're like, psychiatry and surgery, they're so different. How are you choosing between them? Like, psychiatry is a medical specialty and surgery is surgery. So, but to me, I was always looking for the challenge. Psychiatry is super challenging mentally, and surgery is also super challenging physically. And I think the curiosity again in psychiatry, the unknown. There's a lot that's not well understood in psychiatry, and surgery. It was the gratification, satisfaction you get from helping the patient instantly. So when I first went into psychiatry, I wasn't miserable. I liked it. I did it for a bit, but then I realized I really was not happy, and every day I'm going back and I don't feel like it's my place. I don't get the job satisfaction that I thought I would get. And 2.5 years in, I decided to quit my job, which was actually, until today, I don't even know how I took that decision because it's not common for people to change specialties during residency, especially 2.5 years in. Like maybe if you're a few months in or 1 year into your program, you change. But I do believe in following your passion. And like I said, with medicine, it's difficult, but if it's your passion, you're gonna know. There's always this gut feeling, and you, again, like even the difficult times become easier because you know, every day you sleep at night and you're like, I did something today, I helped someone today the way I want to help them. So when I realized that psychiatry wasn't for me, I'm like, okay, I need to go back to surgery, and thank God I did. It's only been a few months now that I'm back into surgery, and I'm, you know, as happy as ever. It's good for the soul, it's good for the mind, you know, as very challenging as it is physically, and we get very little to no sleep. As a resident, everyone knows if you're a resident, it's very, very tough, but I'm still very happy, and you know, it helps keep you moving forward, but you do need to obviously take care of your mental health as well. Try not to burn yourself out, because you can very easily burn yourself out as a medical student, as a resident, even as an attending. So you always need to take care of yourself mentally, and I think these are the good things I learned from psychiatry. My time in psychiatry didn't go in vain, as opposed to what majority of people would say. I mean, the experiences I've had in that specialty, I'm going to carry with me forever. But again, I'm very, very glad. And like I told you, when you sleep at night and you feel like you've done something good today, that's when you know you're doing the right job. And I do believe you should be doing what you love, not the other way around. Because if you don't enjoy what you do, it becomes tedious. You're always, you know, you get burnt out very quickly. And it's tough. It's very, very tough. It's tough as it is, so don't make it more difficult for yourself.
Right. What was a tough time in your career, and how did it change you for the better?
So during my time in psychiatry, I was actually diagnosed with clinical depression, and I was prescribed medications. I had to go to therapy, and it was really, really, really tough. And this is when I hit that low, you know, this is when I realized, no, it shouldn't be this difficult. And obviously it changed me forever, that I realized, you know, you shouldn't feel this way doing anything in life. It's not worth it. Life is really short. So you should always, you know, if you don't feel well somewhere, just move on, you know. And even during my years in med school, I know a lot of my colleagues, they dropped out, or they changed, you know, the specialty. Like they were 2-3 years into med school, and then they realized it's not for them, and they went somewhere else. And you should never be afraid to do that. You know, we're always taught to be on a straight line, you know, never take shortcuts, never take detours. You have to be moving from one thing to the next, but I don't think that's right. You know, take a break. It's okay to ask for help. It's okay to be vulnerable. And I feel like that time taught me that, you know, and to always look at the bigger picture in life.
What are your future goals in science?
So I aspire to be, well, now I'm training in surgery, I'm aspiring to be an academic surgeon. So I would love to have a clinical background, but also an academic background where you do a lot of research, different kinds of research, at clinical, even laboratory research or whatever. So my goal is, you know, in the field or the specialty that I choose in surgery, like the subspecialty, I'd always be someone that's contributing to science, you know, helping things move forward. If, you know, you have a certain experience in a specific procedure somewhere, wherever you practice, and you feel like it's working, and it could contribute to, you know, progressing the way the practice is around the world, you do research, you come to meetings like this, and you share your experience with other people and help, you know, expose the world to new or better things in surgery or in medicine in general. So.
What does your daily routine look like?
As a resident, wake up really, really early, go to the hospital, round on patients. If we have OR day, go to the OR, we operate, and then after that we round again on the patients, post-op patients, and anyone on the ward if there are any issues. You know, do all the paperwork and anything with regards to the patients, like scans, labs, all that stuff. Residents where I train are responsible for. And if I'm on call, then I'd be sleeping in the hospital until the next day, and Yeah, I mean, most of my life is hospital based. Unfortunately, it's very difficult to have a life outside of medicine or outside of the hospital when you're a resident. Most of your time is in the hospital. So we always try, as residents, me and my co-residents, we try to, create a happy environment, friendly environment, because, we're always together. So we try to create a life for ourselves inside the hospital. So if there's like an important football game, I mean soccer, I know you guys call it soccer, we call it football, we'd be watching together. If there's, like maybe friends from other departments that come pass by, or we go see them, or we share meals together, like lunch and dinner when we have the time. And I know it doesn't sound very exciting, but it is nice to be in a place like that, because you're again helping people, you're learning a lot. On a good day, I'd be operating, I'd be learning new things, and because I'm still training, so obviously I can't operate independently, but it's a very good day when my senior staff members would allow me like to do extra steps in a surgery, or they teach me like a new technique or something like that. So yeah, that would be like a typical day, I guess.
Now tell me about the strategy and the mindset behind your role. What does it take to be Dr. Nada Mahmoud?
First of all, the title makes me very uncomfortable. Until today, whenever someone addresses me as a doctor, even when patients address me as a doctor, I'm like, I'm not so sure. I'm deserving of that title, because it's a very, very big responsibility. I think as Nada, the things that make me who I am is that I try very, very hard to be hardworking. I really strive to be better at everything I do. If I do something, and one of my mentors, I forgot to mention earlier, Dr. Carlos Abril, he's also a bariatric surgeon at Clinic Abu Dhabi. He's a fantastic guy, and he always used to tell me, in surgery, if you can do something with your right hand, because my right hand is my dominant hand. He's like, if you can do it very well with your right hand, fantastic. Now try to do it with your left. So you always push yourself to be better. You can do something well, you try to do it better. You do it with one hand, you do it with the other hand. You can, one technique or two techniques, learn a third one. So you always have to push yourself. Always be in a competition with yourself, not with someone else. And also try to be perseverant. Like I said, it's tough, so you have to always remind yourself why you're doing this, what you want from this. Yeah, we say medicine is a noble career and we help people, but if I'm being very honest, a lot of us do this for ourselves more than we do it for other people. Like the sense of gratitude and self-satisfaction that you get doing this job, most of us are actually selfish that way. We just don't like to admit it. This job does more for us than we do for it. You get a lot of opportunities, and I'm not speaking financially, of course, because this job, you spend more money becoming a physician than you actually make money, from being a physician. So the money stuff, because a lot of people, they think, being a doctor, you get paid so well, it's a great career. No, that's not. You shouldn't be doing medicine for that, or for the prestige or the status, because these are things that come very, very, very late in your career, like at a very advanced stage. So the things that I feel like help me be who I am is, like I said, I try to be hardworking. I try to be open to everything, and like you asked me about the pineapples and pizzas, and it's never black and white. There are times when you are going to enjoy pineapples and pizzas, but you, the same person, there are times when you're not going to enjoy pineapples and pizzas, and I feel like we should all strive to be like that. It's never black and white, and you learn this with age, and I feel like psychiatry taught me that as well. It's always just 100 shades of gray. It's never black and white. So yeah, I try to learn every day. I try to grow as a human and as a physician, both, because you can't be one and not the other. And I try to be as harmless as possible.
Do you think the sky really is the limit?
I don't, again, like I said, it's never black and white. There's really no limit with anything if you don't want there to be a limit. A lot of the limits that we have in life are man-made. A lot of the rules are man-made. A lot of the restrictions are man-made, It's never black and white. If there's one take-home message for myself, it would be that,
What would you say is your greatest achievement as a medical trainee so far?
That's a difficult one. I don't think I've achieved anything so far. I'm still quite early in my journey, and it's difficult to speak of yourself. Maybe if if you speak to one of my colleagues or one of my friends, they'd be able to better describe what I've done and what I haven't done. But I don't know, I guess, when you help a patient and you treat them and then they really, really thank you, and they go out of their way. And where I practice in Egypt now, it's common for patients and relatives to get you gifts or like a meal or something. And whenever that happens, I feel like, okay, we must be doing something correct. So I feel like the greatest achievement would be always remind yourself why you're doing what you do. To always remind yourself that, again, we take more from this job and this job does more for us than we do for it, and just, again, to be as harmless as possible, because a lot of people, their ego gets in the way, especially with surgery. And if you meet a lot of surgeons, you'll know what I mean. Just walk around this conference and you'll understand. A lot of surgeons have a huge, huge ego, and I feel like I'm trying, at least, if you were to call it an achievement, to not let that get to me and get to my head. Just remind yourself who you are and where you come from. Try to be as humble as possible.
So do you have any advice for the younger generation of scientists that may be watching this video?
Well, yeah, like what I've been saying, like the whole black and white situation, it's never black and white. Always push yourself to know more, to learn more. Always try to be humble, and stay grounded, and yeah, always be curious, stay curious.
All right, everyone, thank you.
And eat
Thank
your
you so much.
vegetables.
Eat your vegetables. All right, Nada Mahmoud, thank you.